Protecting children remains paramount, but so does keeping them in school. Quarantine, in the face of high rates of transmission and hospitalization, like we're seeing now, remains an important part of our public health response to COVID-19. But out-of-school quarantine has the unintended consequence of reducing in-school learning and can place added strains on our students, our parents, schools, and our local health departments. As many of you, I'm sure, have heard, the Warren County Combined Health District conducted a pilot on in-school quarantine for those exposed as direct contacts. And following this experience, as well as other regional and national experience, affirming the safety of a masked school environment. Today, we're releasing updated quarantine guidelines that schools in Ohio may choose to adopt and parents may choose to follow. But it's important to note that schools are not required to adopt these policies, and parents can opt out if they desire. While vaccination and mask usage are critical components of ensuring a safe school environment to support in-school learning, we're offering an in-school alternative to out-of-school quarantining for students and staff who are exposed to COVID-19 in school settings and school-related activities. Those exposed outside of school and its related activities, such as in the household, should follow standard quarantine guidelines that exist today. The mask to stay and test to play options that we're announcing today are informed by a growing body of national experience, as well as by the pilot I referenced in Warren County and experience shared by other local health departments, all pointing toward a low number of direct contacts that convert to cases within school settings. Our proposed changes that we're actually announcing today, incorporate mask wearing and testing to reduce the chance of spread of COVID-19 and to provide a safe alternative to out-of-school quarantine. Now, when we talk about quarantine, we often refer to direct contacts. These direct contacts are the individuals who were directly exposed to COVID-19 by someone who is known to be a positive case. Remember, COVID-19 is a respiratory virus. It doesn't require physical contact to spread. It's spread through sneezing, coughing, talking, breathing. These factors need to be considered when determining the level of exposure and who is a direct contact. Now, the first new option we're offering is called Mask to Stay, and it applies to participation in the classroom following a COVID-19 exposure in a school setting or another school-related activity. Direct contacts, regardless of vaccination or masking status, may remain in the classroom environment if they do the following. First, wear a mask for 14 days after their last date of exposure. Second, self-monitor or parent monitor for symptoms of COVID-19. Third, isolate and get tested if they start to experience symptoms associated with COVID-19. And that would be regardless of the severity of those symptoms. And fourth, consistent with guidance for others quarantining in low-risk environments, students and staff may discontinue these quarantine procedures after 7 days if they meet two basic criteria. First, they don't develop any symptoms. And second, they test negative between days 5 and 7. This is the so-called 7-day quarantine option that has been in place for a very long time. While parents and students are responsible for symptom monitoring under this guidance, if a school staff member or school nurse sees a child exhibiting symptoms, they should, of course, act accordingly. The second option, which we're calling test to play, applies to participation in extracurricular activities following exposure in the classroom or the school-related environment. Asymptomatic contacts may continue to participate in extracurricular activities if they, first, wear a mask when able. This includes wearing a mask during transportation, like traveling on a team bus, traveling to and from the game, while in a locker room, while sitting or standing on the sideline, anytime that they can reasonably wear a mask. Anytime that the mask won't interfere with breathing, the activity that they're engaging in, or create a safety hazard. Secondly, we ask them to test on initial notification of exposure to COVID-19. So right away, once they've been advised that they have had a direct contact. And then third, test again, sometime between days 5 and 7 following that initial exposure. Now, if they're negative at that time, between days 5 and 7, they of course qualify to test out of quarantine after day 7 and can resume normal activities. I want to point out that the tests can be either a PCR or an antigen test, but they should be proctored or observed. They can't be an over-the-counter test that's entirely self-administered and not proctored. Now, when it comes to test to play, school districts should consider same-day testing for athletic competitions where there's a potential of school-to-school exposure. We're sharing these updated quarantine guidelines with school districts across the state and local health departments today, and they can begin modifying quarantine based on these recommendations immediately. As a reminder, those who consistently wear masks in school and those who are fully vaccinated can already remain in the classroom if they're exposed to COVID-19 in a school setting. I also want to emphasize that vaccination remains our best protection. Nevertheless, the updated quarantine guidelines we're sharing today will allow for as much in-school learning as possible, even as we continue our effort to battle COVID-19.